everyone, and welcome. This is a special edition of our Visual Snow support group where we have a super special guest, Dr. Wong, joining us from London. And we have a lot of UK people in the house. Would you let's get right into it. Go ahead. Would you introduce yourself just a little bit? And then if you guys have any questions, feel free, you can post in the chat, or we can also, I think we can allow people to ask them themselves too. So go ahead, Dr. Wong.
Fantastic. Thank you so much for the invitation to be here. I'm delighted to be here. I've heard about the AnCan group from the Visual Snow Initiative, talking about the development of a visual snow support through AnCan. I was so happy to hear that, because I just know how difficult it can be without having the chance to speak with other people. So I'm a neurologist and a neuro-ophthalmologist. I'm based in London. So I see a lot of people in my clinics who have various visual conditions related to their brain or the optic nerves. And one of the conditions I see a lot is visual snow syndrome. So you all probably know by now, and I'm happy to clarify with any questions and answers. It's a brain network issue, and there is a lot of vision disturbance. So I see a lot of people with visual snow syndrome. And as you all may know, it's a condition of the vision symptoms being really heightened. And we think of it as a brain network dysregulation based on research studies that have shown through various means, whether it's a brain test or whether it's a functional MRI test. And it can be very difficult, particularly as it's invisible, as you all know. I'm stating the things that you all have been, people like you have told me. It's difficult because people don't understand, they can't see what's the issue. And actually a lot of challenge I've heard is about it being understood in the first place, being diagnosed in the first place. So it's been one of my missions to deliver treatment through well-conducted research. So you all may have heard about the mindfulness research I've been doing. And I started it back in 2019. We finished the first round of study in 2022. It was remarkable. I'm happy to talk more about it later. And then now we are therefore able to do the gold standard, a randomized controlled trial using mindfulness to treat this condition. And for me, a big piece of supporting people with visual snow syndrome is ensuring that their voices are heard, for them to be understood. And that's why I was really keen when Sierra Dom told me about the work with AnCan. I said, I would love to come and have a chat with you all, just because I feel it's such an important piece of supporting people with living with visual snow syndrome. So very happy to be here. I did say that really this is an opportunity to meet and just chat rather than I don't have a slideshow to show you. I'm happy to share any questions or thoughts.
Perfect. And sometimes I know with these presentations, you don't have questions just yet. So I want to go ahead and ask, do we have any questions? If not, Dr. Wong can talk a little bit more about that research that she's doing. So no pressure. So if you don't have a question just yet, we can go on to that. You can either post in the chat or you can unmute. Either's fine. Okay, so I think people need a little bit more time. So why don't you tell us a little bit about what's going on with your research and kind of what's happening with that?
Yes, so right now we're doing what we call a randomized controlled trial. That's the gold standard for research for treatment, where we randomly allocate people to either getting the treatment, which is an 8-week mindfulness program, or control or head-to-head comparison. And in this situation, control would be standard of care, which sadly is nothing to offer at the moment. So we ask people to wait for 5 months before we then offer them treatment. So it's going really well. And the delivery of it, all this came about because back in 2019, I had this idea about using mindfulness to treat visual snow syndrome. A lot of it is to do with my particular interest in bringing in holistic approaches, lifestyle interventions, mindfulness into the clinics. A lot of my work is supporting people. Yes, I have the offer of medication. I also want to have the offer of other lifestyle things, whether it's sleep, physical activity, nutrition, their metabolic health, or other things like mindfulness, for example, or such approaches. So back in 2019, I was very inspired to deliver a piece of research using mindfulness. It was quite controversial, to say the least, because it's a bit unusual for a neurologist to come out and say, let's do mindfulness to treat visual snow syndrome. And at the time, of course, there was no treatment, and there was no research trial for treatment back when I first started. So I started off with using a proof of principle. So it was difficult to get funding. A lot of it was me just doing everything in my own time. And I managed to get small amounts of money from 2 charities who supported it in the first place. So that paid for a psychologist to work with me, Dr. Janet Wingrove, who I work alongside to deliver the 8-week treatment. We delivered the treatment modified from a treatment program called Mindfulness-based cognitive therapy. So some of you may know that Oxford Mindfulness has teamed up with Visual Snow Initiative to deliver a mindfulness-based app, really just to get access to more mindfulness approaches. But that is really kind of like an introduction. The further aspect would be like a 8-week program with a live teacher guidance in a group setting. So the reason I chose mindfulness-based cognitive therapy is because there has been a lot of research using this approach, and also it's very structured. So I know there is a body of work, and there is also a specific standard to it. I adjusted it because mindfulness-based cognitive therapy is designed to treat recurrent depression, and visual snow syndrome is not the same as depression. So we modified it. There is a module. So it's an 8-week program where week on week people learn new mindfulness skills. There are themes to each week. It's all set up as per the mindfulness-based cognitive therapy program. There are textbooks that you can get to read about it. But basically, we modified that by removing one of the weeks where it talks about how to prevent recurrent depression, how to pick up recurrent depression symptoms early on. So we changed that because it's not the same thing. We had people with vision symptoms, so we had the chance to talk through about vision symptoms and the impact of that. And there was also a lifestyle chat about things as well, which we have formalized more in this randomized control trial. I realized there was a lot of chat during the discussions about the impact of visual symptoms, but also other things such as, what are the lifestyle things, sleep pattern, and various other things, such as how much caffeine, other things that could affect well-being and brain health. But the key part is actually about the mindfulness program. So it's a group program, it's a group learning program, and it's over 8 weeks, as I mentioned. We got started in January 2020. It was really exciting because we finally got the research ethics through, and it went really well. And COVID pandemic happened, which was really very difficult because if you all remember, social distancing in the UK, that's what we called it, or no group contacts, and actually also on the NHS where we had to stop NHS research because this was done through the NHS setting because we had to do COVID related work. But what that allowed was a window of opportunity to do what we call an interim analysis. And it was remarkable. The first group, just 7 people, they rated themselves of a 0 to 10 scale of how severe it is. They already had a significant improvement on the self-reported scale. That allowed me to, and I presented it at the American Neurological Association meeting, and that gave me the opportunity to raise more funds. I think I shared the difficulty of actually it's hard to actually get funding, and a lot of it I just had to have the conviction and passion. This is really important. We have to do something here. And that was amazing because we managed to get funding, and it was actually VSI, very forward-thinking of Visual Snow Initiative, who provided funding for functional MRI, because I basically asked people to help do things in a volunteer basis, but with functional MRI, they said they couldn't do it for free. So there you go. So I had to raise funding, and the VSI supported it. So that was amazing. So therefore, the first round of study, it showed from the functional MRI a change in the brain after the intervention, and overall the scores improved from the 0 to 10 scale. And that led us to be able to do the randomized control trial, which is the gold standard head-to-head comparison. And this one is also funded by Visual Snow Initiative, the head-to-head comparison trial.
That's wonderful. I know it's a little hard to do functional MRIs for cheap. I know, like for donations, I know that's a little tricky. So that's just fantastic. It's another way that VSI is supporting this community along with this group. So we have a couple of questions come in. I know that we are on a little bit of a time restriction today, so I'll be watching the clock and we can just go ahead and ask some questions.
That's great.
One of the questions we got is, what mindfulness techniques have you used? And then I have a follow-up question.
Sure. The mindfulness techniques are what we deliver as part of the mindfulness-based cognitive therapy program. So there is a theme for every week. For example, there could be practices starting from awareness, getting out of autopilot. So, for example, is bringing awareness to the mindful moments, mindful meal, mindful daily activities. There is a technique called body scan. So there's a body scan approach that would be an example of how we start off. And then each week, because learning mindfulness does require some guidance oftentimes, because it's very normal for people to say, I can't do this. And of course, what's happening is mind is happening as what we expect for the human mind, to notice, to be distracted. And that is exactly what the practice is, to notice that and gently come back. It's a skill. It's like when people are learning how to play the violin or something like that. They need, some guidance, some methodology, and slowly building. So that's why we like the 8-week program of mindfulness-based cognitive therapy. Then it builds on each week. We all come to meet, and then we talk through people's practices and their experiences. And then each week there are additional skills. So the whole range of practices could be, I'm just saying it for people who are familiar with mindfulness practices. It could be, I mentioned body scan. There could be a mindful movement. There could be stretching and breathing, awareness of breath. There is something called the 3-step breathing space to create a little moment of reset, so to speak. So and so forth. There's a lot of it. And all that becomes much clearer as one builds week on week on the practice. The app is really lovely because it's delivered by Oxford Mindfulness, and they've really pulled out certain aspects that could be taught through kind of self-guided practice. So, and of course, it's delivered by Oxford Mindfulness. They have a lot of high quality assurance behind it. So that's why the app has been offered. And for people who want to build their skills, really the next step is to find a skilled teacher to guide them, and often through a group practice. Like, there is the opportunity to do Oxford Mindfulness groups through, online setup. So that would be, say, in the UK hours, but I know people in the US can do that. In the US, there are various other programs, 8-week programs, such as mindfulness-based stress reduction or other types of mindfulness-based cognitive therapy. And there are also other very good mindfulness teachers. The reason I use the word mindfulness-based cognitive therapy or mindfulness-based stress reduction is because for people to deliver that, they really should have been certified through of a specific standard. So that's quite nice. And when it's done in a group, there is a shared experience as well.
Yes, one of the things that I loved that you mentioned is that mindfulness is a practice. It's not something you can get right away, and it takes time. I feel like sometimes we beat ourselves up, I can't master the body scan just yet, or this practice, but still practice, just like practicing the violin. The follow-up question to that is, do you combine mindfulness with NORT?
No, we don't. It's a separate thing. We don't deliver NORT.
Okay, perfect. And we had a question, if you could touch a little bit about symptoms. What are some symptoms that you typically see of visual snow?
So actually, this is probably a nicer one for the people who live with it to share it.
Sure.
So I'm just the interface of what people tell me. So not quite sure whether I'm the most appropriate person to answer this in the setting of people who are having this lived experience. I'll try to answer since you asked that. So there is a range of visual symptoms. It could be like the static of out of tune television, or some people call it visual noise. There are after images. When they look at something, they look away, the imprint is still there. There are trailing of images. They could get excessive floaters, and a whole range. Some people don't get all of it. Some people get parts of it. Some people get maybe the other bits worse than the snow. There's a whole range that I've heard. And there would also often be other non-visual symptoms like high-pitched tinnitus. There could be some sensory disturbance. There could be the sense of depersonalization, separateness, kind of feeling not quite there. And there's a whole range. There's a whole range. And some people have different extent of it. So, it's not the case of everybody has the same thing.
Sure, that was a fantastic way of describing that, because I've been with the group since we formed, and we hear that over and over again. So those symptoms. So thank you for commenting on that.
How long has the group been formed for, Alexa?
Sure. So we have been around since July of last year, and so we're nearly a year old. And we keep growing, which is great. Now we have 2 meetings a month.
Yes. 2 meetings a month. Oh, fantastic.
Yes. And now 1 meeting works a little bit better for those overseas. So it's just fantastic. Thank you for asking that. So we have a question a little bit about the UK and visual snow, which you're great to answer. Do you think that the professional perception of visual snow in the UK is that it's only caused by anxiety? I see more acknowledgement of head trauma as a cause overseas than in the UK.
I think there is a big piece of work to be done for advocacy, meaning increasing awareness and increasing support and destigmatizing the issue. That's why I'm here, actually. That's kind of a lot of work I do when I talk about it. So yes, there is the question about what is this in the first place? And sometimes when people don't understand, do not know how to say what the diagnosis is. So there is the education piece. There is also very understandable anxiety as a result of having the visual symptoms, but it's not the same thing as anxiety. For some people, they say, actually, my anxiety started this. That's a bit different from somebody who says that because I have the vision symptoms, it causes me to be anxious. So it's a whole range. It's, again, like I said, not one size fits all. It's about trying to tailor to what the person is saying. There are a few things that could be contributing to it. So you said about head trauma. Yes, I have seen people after concussion, maybe they get migraines or they get disturbance to their vision after like a post-concussion symptoms. There are various things that could cause the filter. I say the filter because there is this a natural way for our brain to tune things in or tune things out of what could be relevant. And sometimes when there is a lot of disturbance, it's hard to tune things out. A lot of the vision experience that people have with visual snow syndrome, non-visual snow syndrome sufferers, when we get them into certain conditions, we can get them to see it. But usually the brain goes, oh, yeah, of course, this is normal. And then they no longer, they tune it out after that. But when there are conditions that make it difficult to filter, such as severe migraine, post-concussion, or various other things, insomnia, severe sleep disturbance, or for some people, like I say, some people tell me, okay, they had a severe episode of health anxiety, and that kind of led on to a few things, which led on to a few things, which led on to more visual symptoms. So it's a whole range. Like I say, it's very individual, but just to be very respectful of the fact that there is a range of things here.
Sure. And I know that this particular question is UK specific, but I can tell you the fact that our group is so international, I would go as far to say it's everywhere, especially considering you talked about going to the American Neurology Conference. So the question is, when do you think visual snow will be widely known to the UK medical profession? And I'll change that to everywhere.
Yeah, I think actually just hearing, a lot of my research also at the moment is doing what we call qualitative research, structured focus groups, really to really understand somebody's lived experience of this. And also people do come to see me from all over the world, actually, because I get to see them in my private practice from all over the world, also through the National Health Service. So I do get a whole range of feeling of what's happening, and I have this hopeful thing where it's getting more and more recognized now. I have people who said, oh yeah, my optician thinks I've got the snow thing. That's already a progress compared to in the past 2 years. Before that, people talk about going back to optician again and again, and then being dismissed, not being believed. and then getting themselves anxious because the optician say, oh, it's still worsening, come back. And they keep coming back. Of course, because, if they're just kind of told to look up for it, then they may kind of look up for how things could be developing. Their attention could heighten further for their vision, for example. I mean, there's a whole range of things, but I'm hopeful. That's one thing. And what I'm hopeful about is that this kind of, discussion, the work with visual snow related charities, including Visual Snow Initiative, and I know there are lots of other good visual snow charities out there. This kind of work will be helpful. I gathered that, for example, the BBC, there was some radio person who talked about it. I mean, for me, ideally, we can really get this a bit more to the awareness of health professionals. I think it's happening. I was really glad that the Visual Snow Initiative really pushed forward with the ICD classification acknowledgement. So then it's considered as a medical condition, which is huge for conditions outside of, say, in certain healthcare settings where if there isn't a code for it, there is no payment for it, and the person is just left with, what do I do now? And then there is no other resource for providing treatment. There is limited resource for next step work. If people don't really know how bad this is, there may not be an impetus for research funding. Yeah, so there's a huge amount there.
Yes, absolutely. And it takes all of us. I know with working, because at AnCan, we also work with other conditions. It's so important to have that visibility in research because research really does change things in the landscape. I love this next question because I feel like this is everyone in a lot of different ways, or has been everyone. I tried the mindfulness program and I struggle to know if I'm doing it right. So is there a right or wrong way to do mindfulness or the mindfulness program? And my question also, is this a common feeling?
Oh, it's very common. I remember one of the participants in my research group, she's very dedicated to do the work. And she told me at the end, because we do the focus group, she said, after the first session, I was so happy because from the chat in the group, when we finished the call, I rushed to my husband to say, I'm doing it right. Because she was, of course, wondering, is she actually doing the work? A few things. Firstly, having a teacher to guide could be very helpful because, like I said, it's about a skill. There are also some key pointers where, firstly, just knowing that the mind will wander, and there are various aspects. It's about gently noticing it when it happens and very gently bringing it back in. It's also not just about let me just do a laser focus on my breath. It's also really important to have that quality of going, okay, this is happening, this is interesting, that curiosity, the kindness, the non-judgment, they go, okay, this is happening, and just very gently escorting attention back again. And each time it comes back, that is part of the skill to come back, to notice, to come back, to notice, to come back. It's okay to fall asleep, that happens. And then maybe find a time that is not a sleepy time. Or changing position so that one does not fall asleep. But it's also okay when one falls asleep, which means that maybe sleep is needed. So it's like there's the whole bigger picture about how to hone all these things. It's really hard to answer that question specifically, actually. That's why I talk about it's really nice when there is a teacher guiding, or sometimes there are sometimes when you listen to some certain courses, there is this understanding that, exactly like what I said, firstly, it's expected for mind to wander. That's the human mind. And then the practice of coming back is key.
Great. So we should be very gentle with ourselves, is what I'm hearing, and understand that it takes time.
Yes, gentle. And even the long-term meditators will say that, oh, today the mind has been busy. It's not like, oh, this was really bad. No, it's like, the mind has been busy. Lots of, come back. Oh, come back, Or sometimes
I love that.
Yeah.
Because we're not machines. We're human beings. We're not machines. And so we could have different things, different days. So I love that you said that people have been doing this long term, even, the mind is busy. What a fantastic way to reframe that. So we have some other really great questions here. Do you think the mindfulness directly modulates the neural dysregulation of the network underlying visual snow?
Yes, I think so. I think there is a lot of aspects here. I've just written a research piece with Dr. Janet Wingrove, and that's going through peer review. So I was very keen to write that with Dr. Wingrove because we really wanted to share more insights about what we feel as part of the mindfulness program is working so that more people can get access to that. So perhaps for some people, it would be other sort of support that does not necessarily mean doing an 8-week program yet, or it may be other things that supports that. So part of the writing of it, we were also putting together how we feel it's working. So there are a few aspects to it. There is one aspect that is just building this filter to be able to filter out what is relevant or not relevant. That is one piece of it. Another piece of it is also about being able to shift the attention to different parts. So it's create a different change. And there is also the other change with general well-being. You can see from the network, the brain network, that changes as well. So I think there are few ways that through the neuroplasticity, kind of new brain connections, that this is working.
Great. And then we had another question as a follow-up question to that is, can you touch a little bit about what the functional MRIs are showing?
So the functional MRI that we did for the first study, it was for the second and third group. So remember, I talked about how the first group and then pandemic, but we managed to get funding. So then with the second and third group, we managed to get functional MRI. So it showed that the vision, the heightened pathway has settled, and also the default mode network has been, that sense of well-being. There was also a change related to that. So that was really very exciting. It just shows that there is something happening in the brain as what we expect based on what I've just said.
Wonderful. And I know you touched a little bit on this earlier, but we've gotten this asked several times. So due to some of the visual disturbances, even with the eyes being closed, or tinnitus, which you also touched on, that's a big thing with our support group participants. Do you have any tips or any suggestions on either what to refocus on or how to reground when you're practicing these mindfulness techniques?
So for some people, they may find that the vision symptoms when the eyes are closed is very distracting, and keeping the eyes open also fine. Some people actually like total darkness, so some they even put an eye mask. Some people like a little bit of light in the background. So basically, adjust accordingly. It's very individual, So go with what feels good, and then to be able to settle into the body and the practice.
I love that tip. I think sometimes we think with mindfulness we have to have our eyes closed. So I think that is great. Do you have, if mindfulness you've done, you've got a coach, you've worked with someone, and if mindfulness doesn't work for you in particular, is there anything else that you recommend?
There are quite a lot of things to recommend, and all that will be coming up with the research paper that we hope to be published soon. I mean, there is in publishing the research papers, it takes months, but it's coming out. But basically, there are a few things. So I talk about building the filter for brain resilience. So if somebody has an underlying condition that's worsening it, such as migraine, sleep disturbance, or if anxiety is really very high, which are understandable, and sometimes it's a separate condition where they already had anxiety and then they also had visual snow syndrome. So it's about how we support the person with what conditions could be affecting the filter aspect. So other things like sleep, I talk about sleep, so kind of other lifestyle things that will help with a sense of well-being. Nutrition could be a part of it as well. For some people, if their nutrition is affected, it could really affect how they can regulate their brain energy levels. So having that kind of stable blood sugar levels, having kind of a healthy diet with kind of more whole foods based. So those things generally is for somebody to think about for them, for themselves. So that would be the building resilience piece. I have come across some people who maybe they have a condition like ADHD that makes it hard for them to
Yes.
settle with mindfulness practice. So that's why it's really important for them to get the support that they need. It may be that they do more grounding, walking, settling practice, mind-body practices, movement practices, and other support that would be helpful. So yeah, there are various things. So it's not like one size fits all is what I'm saying. What I'm saying is that there is this construct about build the filter, allow the body to settle, noticing the potential locking on to the visual symptoms, how that could be broached.
Oh, I love how you answered that. I do like a comment that someone made, and maybe you'd like to comment on this, Dr. Wong. In my mindfulness practice, instead of pushing the snow away, I lean into it and acknowledge it, accepting that it is there and what it is doing at that time. What do you think about that?
I think that is one of the ways that the program is working. So there is this changing of the relationship to the vision symptoms. Oftentimes when we have noticed from our work so far, but I'm interested to hear from this group if somebody else's experience is different, because your experience is valid. So tell me if it's otherwise. From what we have, our research work so far, oftentimes at the very start of it, there could be this concern about something being wrong. And of course, our body and our vision is there to protect us. And therefore, there is the awareness. And when there is this concern about something going wrong, then there is this fear potentially, or the need to check it to make sure that they can tell the doctors or they can tell a professional about what's going on. Or they may go, is it worsening? Do I need to get other support? So, and then that could be initially the stuff. And then later on, it could become more of a habit rather than a conscious thing where they are noticing the vision more. A lot of people have told us from their work that there is this sense of fear or aversion that they really don't want it. Why do I have it? And wanting to push it away or have this, there is this, so-called their relationship to their visual symptoms, so to speak. There's probably a better way to describe it, but that how they feel about their visual symptoms. Part of the progress that we have noticed so far is that a lot changes with how somebody feels about their visual symptoms. And that sense of the lovely comment about leaning into it or allowing it is part of that change to go, it's okay, it's here, and let me come back to how I notice, my sensation and settling and grounding. So there is that change to the visual symptoms. Another way to think about it, I oftentimes share this little analogy. Let's say this analogy goes this way. Let's say you're meeting your friend for lunch and both of you get to a cafe. It's very busy and lots of tables are filled. And one of the table, there's a man with a dog. Let's just imagine in this scenario, you have a phobia of dogs. Just imagine. You sit a couple of tables away. You're trying to push that attention away. You're trying to get into the conversation with your friend, but there is always this difficulty to really get into it because there is this thing to this dog there, the fear thing. For example, second scenario, you're with your friend, catch up over lunch, busy cafe, tables filled, a table with a man and a dog. Now let's just imagine in this second scenario, you don't feel too strongly about the dog. It doesn't matter to you. The dog's there, the dog's not there. You sit with your friend a couple of tables away. You really get in, catch up with your friend. And as you finish, as you both leave, your friend said, oh, looks like a lot of people have left now. And that's when you see the man with the dog has left. It's like there is a change to that feeling towards the visual symptoms. Could be one of the supporting factors for recovery. That is our thinking process at the moment. So I've been sharing that thought with a lot of people with visual slow syndrome. A lot have said that, okay, it kind of makes sense to them. That is also their lived experience with the first part. But yeah, like I say, I'm respectful of everybody having their own lived experience. So if anybody here has got a different or agreement or disagreement with that, I'm very interested to hear. But that's the kind of concept. So the changing of the relationship. So it could be mindfulness-based approaches. It could be other well-being or supportive approaches. So yes, mindfulness is a construct. And of course, with the research, one of the things I've said is about one of the ways to change minds in the medical field is to show good quality research, which is why I feel that's my place here. I know how to do the research. Let me deliver good quality research and create change in the conventional thinking approach to this. And I'm very grateful to say, it's been very well received. So kind of therefore it's like a principle, and then there are other things that builds on that.
Great. We have an interesting question here. Is it normal, or do you even know, is it normal to develop symptoms in time distance? For example, you can have the visual snow symptoms and then you get the tinnitus diagnosis several years later. Do you know if there's any correlation to that?
Yes, it's very individual with each person's experience. Some people, they get it at the start when everything's really bad and then it settles. For some people, they've had the tinnitus first and then later on the visual notice of visual symptoms. For some people, they never have it. For some people, it comes and goes. So it's a whole variety. So I've also come across people who've had this gap of time before the next thing. So it does vary.
Great, that's so good to know. Is there any evidence suggesting that visual snow syndrome is degenerative?
No, there isn't.
Okay, good to know. So, another thing, and I feel like we get this in our support group a lot and here, sometimes it's very hard to find a doctor or to feel heard, or especially when you're trying to explain your symptoms. Some doctors are not aware of visual snow at all. Some doctors, I think are maybe a little bit hesitant as well. So could you give some advice? What are some things you should be looking for in a provider?
Oh, difficult for me to advise that. So different healthcare setting, there are different setups. In the National Health Service, it's just whoever's local to you. That's the UK.
Mhm.
In the US, I think you've got more options to choose. I think somebody who's trained in neuro-ophthalmology or neurology, they certainly would at least have this framework. Certainly neuro-ophthalmology, which is the interface between the brain and the eye. So kind of that straddle in between the two specialties. People who do that, I think they would certainly be able to diagnose it and find out other conditions that it's mimics. So if it's not visual snow, you want somebody who's be able to pick up a diagnosis that is not visual snow syndrome, that mimics visual snow syndrome, for example. So seeing a neuro-ophthalmologist could be helpful. It is difficult, the access to neuro-ophthalmology, because the numbers wise, everywhere we are relatively small numbers compared to, say, other eye specialties or neurologists. But I think a good eye examination is very helpful. So that could be any ophthalmology. And then working with a neurologist. So let's say if somebody doesn't have a neuro-ophthalmologist they can access. So knowing their eye exam is normal. So an ophthalmologist can do that. A neurologist can often pick up whether there is migraine or other brain conditions. So that's very helpful. And oftentimes, perhaps seeing those two, if there is no neuro-ophthalmologist, can be helpful. I gather that there is like a collection, a directory, I think, the Visual
Yes.
Song Initiative put
Yes.
together. So yeah, I do not know how they curate it, but I would say the broad principles would be make sure the eye is normal, the examination is normal. Somebody who also knows that the brain itself, there's no other. So basically, excluding mimics is part of it.
You answered that question so perfectly. Thank you so much. That had really great information in there. So I really appreciate you answering that. We had a great question, and you touched on this in another question. Someone's visual snow was misdiagnosed because they have migraines with auras, and it was just diagnosed originally as the aura. So I'm curious, does that happen? Is that common? And then the second question to that, do you see a lot of people with both migraine and visual snow?
It's very, very common for both migraine and visual snow. And I think that's to do with the filter. So I mentioned at the beginning, the filtering out of things could be affected by conditions such as migraines or concussion or lots of other things. And that would be one of the big links I see. The starting off of lots of bad migraines with visual aura is also very common. And then there is this awareness of the vision side of migraine. which sometimes then it becomes a case of, oh, is this migraine? Is this something else? So there is then this overlap with attention heightened for vision. So yes, it is a very common overlap. And in the past, but now but a lot of, so you see, for example, there are researchers who are migraine doctors who are really into the research into this, which is really related to this overlap, really.
Great. Thanks for answering that question. And JC, I see you have your hand up. Would you like to ask your own question?
Yeah, hi. I suffer with visual snow with migraines. And going back to your previous question to Dr. Sue, I went on the VSS website and found Dr. Polida and contacted her. She was happy to see me, so I went back to my GP and got a referral that way so that I could see her. But recently, when I saw Dr. Polida, she mentioned that a lot of neck pain that I get is due to the visual snow, which is getting worse. So I wondered if there's anything that you could do, is there any sort of treatment for that?
Yes, that's an interesting question because, of course, there are lots of potential causes for neck pain. And this forum is really just a general thing. So this is not personal medical advice, as I'm sure you
Yeah.
So general comments when people have neck pain, I'll be thinking about what is their biomechanics. So then there's a question of what kind of assessment could be helpful, physiotherapy assessment, postural assessment, soft tissue work, all that could be helpful. And then what else could be worsening this? So I talked about certain types of maybe physical therapy type work. So kind of movement, release of this from a biomechanics point of view. It's also very common when people hold stress in their shoulders or their neck. So it's about how to support the underlying cause and also deal with any other things such as soft tissue work or kind of breath work or grounding work. So the advice does vary quite a lot. And I would say oftentimes having a really skilled and really holistic physical therapist, physiotherapist, or somebody who does soft tissue work is probably the best person to be in your corner.
Okay, thank you. I usually have a massage every few weeks, so yeah.
Ah, fantastic. Oh, that's lovely. That's lovely. And the key thing you may want to see what's your habitual posture, what else can be done for strengthening. Oftentimes it's a combination of soft tissue work and strengthening. That would be the kind of the realm of the physiotherapist or the movement type guidance, really. So yeah, kind of working with all those people really could work well. Some people really like acupuncture as well. So there's huge range of things that you can look for. But the key thing is you want to find somebody who you feel you can work with, and somebody who you think actually is skilled. And there is a huge range. It's very difficult because there is no like one specific accreditation. I mean, apart from being a skilled physiotherapist, and there are different types of accreditation, but people can come to it from different ways.
Thank you.
Thanks so much for asking your question. I appreciate that. I have a question, Dr. Wong, that I feel like is asked in every single support group that we have. So I'm going to be interested to hear your thoughts on this. Do the visual disturbances get worse over time or with age?
It could get worse over time if, let's say, there is further heightening of the visual awareness, whether it is the filtering aspect, difficulty filtering things out, whether there's worsening migraines, or there could be this, for one of a description, more like a unconscious habit to just check what's going on with the vision. So then the brain pathway of vision could be heightened, or it could just be a case of, there are other underlying causes that's worsening the filter. So if it worsens, I'm very fortunate that, when people come and see me, we talk through various things for them. We look at what else could be their underlying causes. We support them through that, and people get better. when they go through this process with me. But of course, as you can imagine, there's a whole variety of people's experiences. So for some people, if things are worsening, migraines or other underlying triggers, it could just worsen. Not typically, say with age, but it's more about somebody's own personal journey. So all this is extremely personal, I would say.
Absolutely. Do you have any other patients that have neuropathy, neuropathic pain, or paresthesia?
It's very common, I find. Well, common, I do not know the percentage, so I will have to caveat that. But I often hear it where people may get other sensory disturbance. The word neuropathy is a bit different. So the word neuropathy in classic neurology sense, we would talk about it as the nerve actually being damaged. In people who have visual snow syndrome, where they get sensation that feels like a nerve damage, the nerve is actually functioning fine, but they have the symptoms. It's very similar. So they can get like tingling sensations in the body that is kind of part of this condition. Yes. And it's certainly something I'm really keen to be able to see how we can understand this further. It's probably part of this whole brain network and the whole awareness of a lot of sensation aspects going on. Of course, the other thing is that in migraine, which very commonly occurs with visual snow syndrome, it can cause a lot of sensory changes in the body as well. So there's a lot of factors that could be involved here.
Sure, thanks. We have an interesting question. Have you come across any patients that developed visual snow after pregnancy or being pregnant?
I've certainly got, well, not specifically in that, but I can think of how that could happen. So, for example, let's say if somebody, during their pregnancy, they have one of these things that just affects their filtering out of visual symptoms. So it wouldn't surprise me if that happens. It's not something that I hear commonly, but the person who's experiencing that is real for them. That is their experience. So that is true for them. And yeah, so that is interesting for me to hear.
Perfect. And I think this will be, I'll ask you one more question, but this will be kind of our last audience question because I want to give you plenty of time to answer this one.
Yeah.
Do you think there will be a cure one day for visual snow syndrome?
Oh, yes, I think so. Certainly. We're certainly in that direction already. We're starting to understand the various potential mechanisms. I talk about the filtering, I talk about the attention awareness, I talk about how we can build resilience, how we can shift attention, how we can change this relationship to the visual snow symptoms that then allows it to let go, and then the brain does not need to pay attention to it because then it's no longer important from the brain point of view. Then it just kind of goes, that sort of thing. Of course, it's not as easy as that I'm saying, but that would be the way I'm thinking about it. So yeah, certainly. I mean, I have people I've looked after who's it's gone. So there is this framework around it that we can work with.
That, oh my gosh, I love that answer. I think I saw smiles. So people were like, yes, yes, this is so encouraging. Love it. So my final question for you is there something you'd like to leave us on, or is there something that we didn't ask that maybe we should have?
I know. I just want to say thank you for having me here. It's such a privilege to be able to speak with all of you. It's very special, to be able to be in this forum. And I think just to know that you're not alone, what you feel is valid, and there is a way forward. And a lot of the way forward is just taking a moment, taking care of yourself, seeing what needs support with, and all that is part of the process. So yeah, have hope, and also, just give yourself what you need in terms of your care. And the holistic approach really makes sense from a brain point of view.
Perfect. And is there anywhere, do you have a website, social media? Where can we find you?
So I do have, I have a book on mindfulness, which actually I was very surprised. I've got some patients come to see me and say, I read your book, I love it. I said, oh, I'm so touched. So I have a book, Mindfulness for Brain Health. I don't have it in front of me. And I'm really, really, really passionate about empowering people to take control with lifestyle-based approaches. So I'm working on a book. It will take me a year to come up with it, but I'm working on some courses that people can self-pace, but it's really about more like lifestyle approaches, whether it's sleep or their metabolic health and various things like that. So I have a website. It's drsuiwongmd.com. So that's drsuiwongmd.com. That's really for you can find my books there. There's a book about sleep there as well. I have a newsletter about really a lot about well-being and brain health. It's called Thursday Tips. So people, when they go on my website, they can sign up if they wish. So every Thursday, you'll hear a little bit from me with some brain health tips, some well-being tips. Do keep in touch, and hopefully my book will be out soon, and that will then be a more comprehensive approach.
Super quick, because we had a question about one of your books. Is there an audio book? Since sometimes there's this. Okay, good to know. I'm so happy to know. Perfect.
There is audiobook. Let me actually give you a moment. I do have my book.
And I know everyone, including myself, is now a super big fan of Dr. Wong too. So you've gained a lot of new fans. So
it's so kind.
You're gonna end up on the New York Times bestseller list pretty soon, I bet.
So kind. Well, if that happens, that would just help more people. My mission here is to help more people. So I have my book called Mindfulness for Brain Health. There is my meditation guides in there too. I've got this book about sleeping. So it's more about, it's a workbook really to help people get into sleep hygiene. And this one I feel also is really important about brain energy, metabolic health. So sweet spot for brain health. So those are some of the books that may be helpful for people with visual snow syndrome. And like I say, I do intend to create courses that people can just self-pace and do it according to their own time. There are many tasks to do as part of this bigger mission. So it's all a little bit at a time, but there will be the intention. So very, very happy to support. I do have a private practice, but my private practice is in London, so people do have to travel to see me, and they can find the links on my website. But that's slightly different. That's a medical consultation. What I'm doing here is more of a advocacy type work.
Absolutely. And we appreciate having advocates just like yourself bringing more awareness and attention to visual snow syndrome. Thank you, Dr. Wong, so much for coming to visit us today. We would love to have you back sometime. And guys, feel free to stick around. I'll be on a little bit after. So if you'd like to sit and talk with some of your peers, we can go ahead and do that. But thank you, Dr. Wong. We appreciate everything you're doing for this community.
Thank you. It's a pleasure and a privilege. Thank you, everybody. Thank you for all your great questions.
Thank you so much.